social emotional learning is a key topic out there. So Barb, why do you believe it's important to integrate social emotional learning across academics?
Having a social emotional learning program that's delivered by teachers, maybe even just a half hour a week, has great evidence base. When we think about our students with mental health or behavioral health issues, almost always they have problems with their academics. Similarly, our students with learning disabilities or other kinds of reading problems, their package also involves behavior problems. The new Colorado academic standards that are for comprehensive health and physical education actually show grade level expectations for our students for social emotional wellness. It gives teachers as well as families kind of a framework of what do we think our kids need to be learning in terms of their social emotional competencies, and also to kind of have a stance that this isn't some kind of in-child problem that we're talking about, but rather these are skill deficits. Just like we teach our students that have reading problems, we can also do more teaching and giving opportunities for practice and positive acknowledgments for students with behavioral health issues.
It's not just the teachers, but it's more about everybody getting involved. Who else is involved in that partnership side of it?
The other thing with the academic comprehensive health and PE standards is we don't see them being taught in just health or just in PE, but rather they're integrated, that everybody's involved in looking at social emotional wellness as part of the school day. What we really talked about a lot today was using a whole school approach to mental health. And when I say mental health, I often mean behavioral health as well. So we're really looking at the public health model with a multi-tiered system of supports where you really are integrating both academic and behavioral interventions, and then thinking about what works across the tiers, how to really translate that to behavioral health in the school and integrating it across the school day. It needs to be team directed, and there really needs to be, again, a framework. I'm really heartened, first of all, by our inclusion in this conference, but also I think now there's greater realization of the impact that behavioral health has on other components of health, as well as vice versa. More than 300 research studies involving 270,000 kindergarten to 12th graders showed that if you had a social emotional learning program, academic gains are as much as 10 to 15%, but a whole host of other positive outcomes, including better attendance, better grade points, less disruptive behavior, better school engagement. These kids like school more. So all kinds of positive outcomes.